health and wellness sector in the country has been long awaiting, a truly comprehensive platform for recognition and salutation of its varied facets through a fierce and peer-driven process. Thus was born the Indian Health and Wellness Summit and Awards 2014 IHW Awards, the first ever initiative of this kind to be managed by the media, health sector bodies and organizations. It was held in the Hotel Hyatt Regency, New Delhi. IHW Summit and Awards is an initiative of the Hero Cycles and powered by Yes Bank. The event was inaugurated with great pomp and show.
I now request our chief guest to come forward and commence the evening with the lamp lighting ceremony. I request our Honorable Minister, Mr. Shripad Yesanayak ji, to come forward.
The India Health and Wellness Summit 2014 brought together health and wellness professionals, investors, entrepreneurs, managers, and strategic players from the health and medical fraternities of India.
As I'm on a pre-planned tour away from Delhi. I'm greeting you through this video message. Wellness is a total concept. It's a physical health plus mental health.
All our efforts are in furtherance of our Honorable Prime Minister's vision to make the country a better place to live for its billion plus population. We are dedicatedly working for the push the reach of hospitals and clinics to far corners of India so that healthcare does not remain a prerogative of urban and affluent Indians. The eagerness is to learn as well as to understand our country and our system. The announcement of June 21st as a World Yoga Day and the increased interest of the global community towards the conventional health system are proof of the fact.
I request Mr. Shrikant Ganduri from Yes Bank Foundation to please come on the stage and give the Yes Bank report to our Honorable Minister.
The event preceded by the Brainwaves Health Knowledge Summit to deliberate on burning issues related to healthcare industry. The unique and mega discussion forum brought together all stakeholders in the discourse under one umbrella.
The challenge that I placed before Dr. Mishra was, how do we break down silos in healthcare to look at health in India? To Raghu, the question was, how do we bring things together to count for health in India? And to Mr. Pathak, the question was, how does health get influenced, or how does health come out of total sanitation?
What has India seen over the last 2 decades is the growth of tertiary healthcare in the metropolitan cities and maybe tier 2 cities as well. And that is where, when you were talking about the accessibility to this tertiary care and affordability, there are 2 important issues which come. India largely lives in villages.
We are seeing a lot of trends in India, and that set me wondering. I had a gap of about 6 to 7 years when I was not in India, and I came back, and so I saw a lot of stuff which had changed. Sometimes the gap gives you don't see the continuum of change, so you can see the changes occur. If you look at some of the key HDI indicators, infant mortality ratio in UP is still around 60. A fertility rate for a lady there is still 3 to 4 children. Whereas down south in Kerala, you are somewhere at 15, 16.
As you say, health is wealth. We talk many things, nutrition, other things. Water, sanitation, both come first. And we are not adopting the Indian methods to provide good drinking water, good sanitation, and therefore we are lagging behind.
Starting from the last, whether it's governance or whether it's even our ability to model things for our country, which is evidence-based, or even looking at how do we do teamwork, even within the settings of healthcare provision.
The discussions were centered on key trends and burning issues, with an aim to set an agenda for policymakers and industry players towards the goal of common good and growth. The forum is pivoted around the objectives of a state of informed decisions and policy movement with clarity.
Out of every 100 grade A nurses we estimate you have about 10. Out of every 100 medical doctors we estimate you would have about 20. I think we just have to accept that to deliver well, we need to spend much more than we are spending today. We spend 1% of our GDP on health. That's, Brazil spends about 3%, other countries spend 4%. We just cannot do more with 1%.
How do you measure this investment in health? Education lobby has been very successful over the last, I keep saying this, that civil society put tremendous pressure on the government over the last decade and a half and was able to give a focus to education.
Why can't we somewhere link health coverage or this healthcare system onto that platform? Because if you have mapped those people and you have a database, why can't we link? You don't have to reinvent the whole thing again.
It could essentially be because they tend to believe that the quality of care they can expect from the doctors in some of the leading government hospitals in the country is still much better and more reliable and probably more trustworthy as compared to some of the private so-called branded hospitals.
One, the healthcare providers worry about the investment that they might need to make while going down the NABH route or JCR, which is even higher. And the second is there value in terms of getting an accreditation, making that investment, because you're going to get reimbursed the same way irrespective of whether you're accredited or not.
I think this is a rare opportunity where all of us can come together and share ideas.
Methods to improve the healthcare and the dream of the Prime Minister Health for All can come true with these kind of discussions.
The IHW Awards is the most comprehensive recognition platform with over 60 awards in multiple categories.
Ladies and gentlemen, going on to the single specialty hospital of the year. Can we have the nominations?
The nominees are Fortis Sea Dog Healthcare Limited, Norwalski Warrior Maternity Hospital, and Fortis La Femme.
Single specialty hospital of the year is Nauroji Wadia Maternity Hospital.
The Indian Health and Wellness Summit and Awards 2014 also organized a cultural program with mythological music and dance.
पुष्टिवर्धनम् उर्वारुकमिव बन्धनात् मृत्योर्मुक्षीय मामृतात्
Many national participants and awardees appreciated the interactive session with award function.
This event is about trying to understand how health and fitness management can be spread out across the country.
In fact, this is one summit which is talking about prevention of healthcare, rather than treatment alone.
really motivates everybody in the industry and will have everybody strive for excellence and quality.
I think this conference is a great idea of actually bringing together new innovations, new ideas, encouraging entrepreneurs in continuing their effort on building breakthrough businesses in healthcare.
An ambitiously and meticulously planned initiative, the IHW Awards 2014 is causing a buzz in Indian healthcare sector and attracted huge participations and a wider media response.
As far as the awards are concerned, this is a great initiative.
It gives them a lot of enthusiasm to work further, to work towards the excellence in their respective fields. I think it's a great idea.
Summits like these are beautiful platforms for India to even start thinking that, okay, you know, we have been blessed thanks to medical technology, thanks to science. We have been blessed with extra years in our life.
We should encourage these kind of summits, and definitely I think health comes first, and it's a synergy of health, beauty, everything goes hand in hand.
So I think it's really important that recognition is happening finally in the Indian health industry. It's important to get concerned people and key opinion leaders together.
Indian Health and Wellness Summit and Awards 2014, the most advanced and futuristic platform on healthcare and well-being in the country.
This summit was basically to bring together a lot of ideas which are directly related to health and are not directly related to health, but have a substantial influence on the health care scenario of the country.
The event completed with a positive approach for Healthy India.